Well, news of actor Bruce Willis stepping away from his career due to a medical diagnosis shocked many fans. He suffers from a brain disorder known as aphasia. With more on what this is and how to tell the symptoms is local neurologist and pain management expert Dr. Chad Domingue with the Avila Health Network. Thank you so much for joining us.
Yeah, good morning. Very difficult. One of my favorite actors, so definitely have a heavy heart with this story today.
Yeah, that took a lot of folks back. So what exactly is this and the symptoms?
So aphasia, just for the viewers, is not a diagnosis. It is a symptom. So when you're talking about aphasia, you're talking about the brain, obviously, and specifically, you're talking about the left side of the brain. So the frontal lobe controls our ability to express ourselves. So if you damage the frontal lobe, it is an expressive aphasia. You can understand, but you can't speak and you can't write. The temporal lobe allows us to receive. So it would be a receptive aphasia. We can hear, we can put words out, but we can't understand it. Aphasia also needs to be separated from dysarthria. So dysarthria is the mechanical production of speech. Our lips, our tongue, our palate. So it has nothing to do with our ability to process it, but the mechanical production of speech. Both of these symptoms are not a diagnosis. Majority of people with aphasias have stroke, neurological disease, but again, this is a manifestation, not a diagnosis itself.
Always educating us, Doc. Okay, so as a neurologist, when patients ask what causes this, what do you say?
So as I mentioned earlier, most common is stroke. So anywhere from 25 to 40% of people that have a stroke will have an aphasia. Again, receptive aphasia, expressive aphasia, or you can have a global where the whole brain is kind of disconnected. When you see these patients, it's sometimes hard to determine what's going on. They can fool you. Someone with a receptive aphasia will talk like a word salad, like they just throw words out and it doesn't make sense, whereas someone with a receptive is like they're talking a little bit, but you just really don't understand kind of what they're doing. And again, you got to look at how they processing the language to make sure it's not a dysarthria. Other things that can cause this, seizures can cause this, medications sometimes can cause aphasias or dysarthrias, and dementia can cause this. I think in Bruce Willis's situation, as you read a lot of the articles that are coming out, it sounds like his memory was being a problem as well. So I think, you know, he's probably got some type of neurodegenerative dementia that's manifesting itself as this aphasia.
And whether for him or a loved one that is dealing with this or you notice this, is it treatable? Can you reverse time and fix it?
Yeah, unfortunately, you know, majority of these patients, you know, whether it's a stroke, whether it's dementia, you know, medication, seizures is really unlikely. You know, unfortunately, Liz, majority of times, you know, it is what it is. There's really nothing to reverse it. You know, when you look at treatment, obviously, you know, you and I have discussed stroke before, prevention, you know, manage your blood pressure, blood thinners, smoking cessation, healthy lifestyle. Once the injuries happen, you know, most of the treatment is just kind of accommodating the patient. So using electrical devices to help the language deficits, speaking slower, using smaller words, you know, speech language pathologists are very, you know, well trained in helping that. But unfortunately, as we're seeing with Bruce Willis, you know, you can imagine your life, just like yourself, you know, is language. To lose that, it'd be like me as a surgeon, you know, losing my hands. It's very devastating to see someone deal with, you know, these type of neurologic problems.
Yeah, well, it is sad to hear this, and for those dealing with this, and hopefully one day we'll be able to reverse time, so to speak. So thank you so much for explaining that
Absolutely.
today.
Yeah, my pleasure. Always good to see you guys.